Narcissism is a term that has become more and more common in today's society. You may have heard it thrown around in casual conversation or seen it depicted in movies and TV shows. However, it's important to understand what narcissism truly means and how it can impact individuals and their relationships. This video content will delve deeper into narcissism and its effects. Narcissistic personality disorder, or NPD for short, is a condition that affects a small percentage of the population. It's important to note that there's a difference between healthy self-esteem and narcissism. Self-esteem is a healthy sense of self-worth and confidence, while narcissism is an inflated sense of self-importance and entitlement. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, outlines a diagnostic criteria for NPD, which includes a grandiose sense of self, importance, a need for admiration, and a lack of empathy. While genetics may play a role in development of narcissistic traits, environmental factors can also be significant. Studies have shown that individuals with a family history of narcissism may be more likely to develop the disorder themselves. Twin studies have also shown a concordance rate for narcissism in identical twins versus fraternal twins. Parenting styles can also contribute to the development of narcissistic traits. Overpraise and excessive admiration can create a sense of entitlement and a need for constant validation. Overprotection and indulgence can lead to a lack of empathy and an inability to handle criticism. Neglect and abuse can result in a distorted sense of self and a need to control others. Early childhood experiences, including peer relationships and school environment, can also contribute to the development of narcissistic traits. Children who are constantly praised and told they are special may struggle to handle failure and criticism later in life. Those who are bullied or ostracized may develop a sense of entitlement and a need to prove themselves. Cultural and societal influences can also impact the development of narcissistic traits. Social media and celebrity culture can create a distorted sense of reality where individuals are constantly comparing themselves to others and seeking validation through likes and followers. This can lead to a need for attention and a lack of empathy for others. Please take a moment to hit the like and subscribe buttons if you enjoy this content. Now back to the video. It's important to note that narcissism exists on a continuum, with healthy narcissism on one end and maladaptive narcissism on the other. Healthy narcissism involves a positive sense of self-worth and confidence, while maladaptive narcissism involves a sense of entitlement and a lack of empathy. Adaptive coping strategies, such as a positive self-affirmation and accepting feedback, can help individuals with healthy narcissism maintain their self-esteem. Maladaptive coping strategies, such as denial and avoidance, blaming and criticism, and projection and manipulation, can perpetuate maladaptive narcissism. Narcissism can have significant effects on relationships, both romantic and familial. In romantic relationships, individuals with NPD may idealize their partner initially, but then devalue and discard them when they no longer provide the validation they crave. They may struggle with empathy and view their partner as an extension of themselves rather than a separate individual. Power struggles and manipulation may also be present in these relationships. In family relationships, narcissism can manifest in parent-child relationships. A parent with NPD may view their child as an extension of themselves rather than a separate individual, resulting in neglect or abuse if the child does not meet their expectations. The child may struggle with a distorted sense of self and a lack of boundaries. Narcissism is a complex condition that can have significant impacts on individuals and their relationships. Understanding the factors that contribute to the development of narcissistic traits and the difference between healthy self-esteem and narcissism is important. Adaptive coping strategies can help individuals maintain healthy self-esteem, while maladaptive coping strategies can perpetuate maladaptive narcissism. Narcissistic traits can also have negative effects on relationships. It's important to seek professional help if you or a loved one is experiencing symptoms of NPD or struggling with narcissistic traits. In addition to seeking professional help, there are also things you can do to support someone with NPD or narcissistic traits. It's important to set boundaries and not enable their behavior, while still expressing empathy and compassion. Recognize that their behavior may be the result of deep-seated insecurities and try to approach the situation with understanding. Overall, understanding narcissism and its effects is crucial in today's society. By recognizing the factors that contribute to the development of narcissistic traits and learning how to cope with them, individuals can work towards maintaining healthy self-esteem and relationships. Also, attachment styles play a crucial role in the development of personality and behavior, including narcissistic traits. Attachment styles refer to the patterns of behavior and emotions individuals use to relate to others, especially those they are emotionally attached to. The concept of attachment styles was developed by psychologist John Bowlby, who believed that a child's first attachment experience with their primary caregiver sets the foundation for their future relationships. There are 4 main attachment styles: secure, anxious preoccupied, dismissive avoidant, and fearful avoidant. Attachment styles develop in early childhood through interactions with their caregivers. Secure attachment is characterized by a child feeling safe and comfortable exploring their environment with the knowledge that their caregiver will provide support and comfort when needed. Anxious preoccupied attachment is characterized by a child feeling anxious and uncertain about their caregiver's availability and response. Dismissive avoidant attachment is characterized by a child feeling emotionally detached from their caregiver and preferring to rely on themselves. Fearful avoidant attachment is characterized by a child feeling fearful of their caregiver's response and not knowing how to respond to their caregiver's behavior. There is a connection between insecure attachment and narcissism. Research has shown that individuals with insecure attachment styles, particularly anxious preoccupied and dismissive avoidant attachment styles, may be more prone to developing narcissistic traits. This is because these attachment styles often stem from an inconsistent or unavailable caregiver, which can lead to a lack of trust and reliance on oneself. This can result in a distorted sense of self and a need for validation from others. There are several psychological theories on narcissism, including psychoanalytical theory, social learning theory, and cognitive theories. Psychoanalytical theory, developed by Sigmund Freud, suggests that narcissism develops as a result of unresolved conflicts during early childhood related to the child's relationship with their parents. Objective relations theory, a development of psychoanalytical theory, suggests that the way individuals relate to objects, including other people, is shaped by their early relationships. Social learning theory, developed by Albert Bandura, suggests that narcissism develops through reinforcement and punishment of certain behaviors. Individuals with NPD may receive praise for exhibiting certain behaviors, such as self-promotion or entitlement, while criticism for showing vulnerability or empathy. This can reinforce maladaptive narcissism and perpetuate negative behaviors. Cognitive theories of narcissism suggest that individuals with NPD may have cognitive distortions that contribute to their sense of entitlement and lack of empathy. Aaron Beck's cognitive model suggests that individuals with NPD may have core beliefs that lead to cognitive distortions, such as a belief that they are superior to others and entitled to special treatment. These cognitive distortions can perpetuate narcissistic behavior. Attachment styles play a significant role in the development of narcissistic traits. Insecure attachment styles, particularly anxious, preoccupied, and dismissive avoidant attachment styles, may be more prone to developing narcissistic traits due to a lack of trust and reliance on oneself. Understanding the psychological theories of narcissism, including psychoanalytic theory, social learning theory, and cognitive theories, can provide insight into the development of narcissistic traits and potential treatment options. It's important to seek professional help if you or a loved one is struggling with symptoms of NPD or narcissistic traits, as these can have significant impacts on relationships and overall well-being. Prevention and treatment of narcissism is an important topic to address, as it can have significant impact on individuals and their relationships. Early intervention strategies, such as parenting techniques and school-based programs, may be effective in preventing the development of narcissistic traits. Parents can promote healthy self-esteem in their children by providing support and validation, while also setting boundaries and modeling empathy. School-based programs can focus on promoting positive self-esteem and social skills, as well as addressing bullying and other negative behaviors. For individuals with NPD or narcissistic traits, psychotherapy can be effective in treating the condition. Cognitive behavioral therapy, or CBT for short, can help individuals identify and challenge negative thoughts and behaviors, while dialectical behavior therapy, DBT, can focus on emotion regulation and interpersonal effectiveness. Psychodynamic therapy can explore the root causes of individuals' narcissistic traits and provide insight into their behavior. Coping strategies for family and friends of narcissists can include setting boundaries and focusing on self-care, while also expressing empathy and compassion. It's important to recognize that narcissistic behavior may stem from deep-seated insecurities and to approach the situation with understanding. In conclusion, understanding and addressing narcissism is crucial to promoting healthy relationships and overall well-being. Early intervention strategies in psychotherapy may be effective in preventing and treating narcissistic traits, while coping strategies for family and friends can help mitigate negative impacts. It's important to approach the situation with empathy and understanding, recognizing the complex nature of the condition. Continued research and conversation are encouraged to further explore and address narcissism. We recommend these other videos we made on narcissism for you to further your research on. Click the links now to begin watching the other videos we made. See you next time.